Good morning, students. So today is the last lecture among the online classes of anatomy, and the topic of the lecture is radiological anatomy of head, neck, and face. I am Dr. Madhavi Kevle, MBBS MD Anatomy. So let's begin the lecture. So in the first slide, you see, first you have to understand what kind of X-ray is this. So here you see a plain radiograph of head with a posterior anterior view. Now, what do you see in the plain radiographs of head and neck? First of all, you see some bones. So bones will have which kind of shadow, students? They will have radiopaque shadow. Which kind of shadow they will have? Radiopaque shadow. So what are the bones that you see in the plain radiograph of head? You will see, and also the neck. When you see the head, you will see skull bones, you will see mandible, and in the neck portion you will see the hyoid and some parts of cartilages of the larynx which are ossified, if any, means it depends on the age if it is ossified or not. And also you will see the cervical vertebrae. Now what are the radiolucent shadows? So what do you mean by radiopaque shadows? Means the bones will look white on X-ray. And what are radiolucent shadows? Means the air filled cavities and tubes which will be seen dark or black in X-ray. So which are the air filled cavities? Here you can see some air filled cavities. Here you see the dark. So air filled cavities will be the oral cavity, nasal cavity, yes, and some air filled cavity here, the external auditory canal, you can see little bit here. And then other things are the paranasal air sinuses, mastoid air cells behind the ear. Yes, sometimes you can see in the neck region you will see the pharynx, laryngeal cavity, trachea. And what will give these gray shadows? You can see these gray shadows here in the sides. So what is giving the gray shadows? The gray shadows is due to soft tissues, means muscles, tendons, ligaments, vessels, and nerves. So we cannot differentiate. Can you tell for example, can you tell sternocleidomastoid or masseter muscle? No, you cannot differentiate. But you can say that the gray, this gray zone contains soft tissue. That's it. That's all you have to say. Okay. So this is the. So when you are asked, you will tell that this is the plain radiograph of head, PA view, and what you see here. What you see here. So how is it taken first of all? Means if it is a posterior anterior view of the forehead, then the individual is facing the film and the this orbitometal canal, means the orbits. Yes, they should be facing lying perpendicular to the film of the X-ray. Yes, and now which other things you can see? You can see the sutures. So which are the sutures that you can see? You can see the sagittal suture, the coronal suture, yes, a part of the lambdoid suture coming from behind. All this you can see. You can see the inner and outer table, see marked with the I and OT. This is the inner and outer table. Yes, all this you can see. And what lies between the table, students? It is called the diplo. So you can see the diplo. All that you can see. Now here you also can see the frontal air sinus. Yes, this is the, here you can see frontal air sinus. Yes, it is marked with an FAS. Then the EAS, you see EAS here, the marked with the EAS, it can be seen, that is the ethmoidal air sinus. Now the NS that you see in the middle, that is the nasal septum, the NS, nasal septum. Then you can see inferior nasal concha, inferior nasal concha, here IN, this INC, and MAS is the maxillary air sinus, the biggest of all. the maxillary air sinus on both the sides, these ones, MAS. Now you can also see some, what is this white colored? Since it is much more white than even the bone. Guess it is the false tooth that they put, or the denture. We call them the denture. So next topic. So in the lateral view, what you can see of the head and neck, you will again see how it is taken when the person, one side of the head is towards the film. So one side of the head is towards the X-ray film and the other side is towards the X-ray tube. Yes, and then the neck is tilted. However, the it depends on the radiologist how he wants it, and in general the neck will be tilted in this situation. Then the orbital, this opening will be facing up. They want, they can take a X-ray in which the face is horizontal also, means the neck is not tilted. So that depends on the radiologist and according to condition of the patient what we need. So now let's see in this what you can see. You can see the uh, this part, you can see here. Let me show you. This part inside, this is the anterior cranial fossa. Yes, here will be the, you see the whitish, this is external auditory meatus. Here this part you see, this is the pituitary fossa, and this dark black means there is a sinus, right? So here just above the orbital cavity, what is this? This is the frontal air sinus. Okay, frontal air sinus. And also you can see the skull cap. This is the skull cap. You can see, you know what this is? This is the dens. So which cervical vertebra has this structure called dens? You should study and know the osteology before coming for the viva of radiology of anatomy. So it is all connected, students. First you learn the osteology properly. Then you can see if the you can see the false dentures again in this patient, means the false tooth that they have implanted. You can see those, or the sometimes they just implant a cap over the tooth. So it is made of another, maybe it is made of metal. Then you can see it of other density than the bones. Now here you can see the posterior cranial fossa in this part. Yes. So try to answer maximum that you can see. So in this you can see the neck. So here you see, this is the, what is this? This is the mandible. So they will ask you about the temporomandibular joint here. They can ask you to count the vertebrae. They can ask you to count the vertebrae, so you can see the numbering here. Then they will ask you the joints of the vertebra, cervical region. Yes, then they can ask you atlanto-occipital joint. So what is atlanto-occipital joint? Yes and no joint. They can ask you directly which joint is responsible for yes, which joint is responsible for no. Where is the hyoid? Can you see the hyoid? So small bone here you can see like that. Then that will be the hyoid. They can ask you from the sides which sinuses you can see here. This is the oral cavity again. So this is the neck lateral view. Now we can inject some with the help of a catheter. Sometimes we can use the radial artery or femoral artery, and we can inject a contrast material into the, then it goes to the internal carotid artery. Yes, and then we take the x-rays. So this procedure is called the carotid angiography. And why we have to do it? To see the lumen, to see the inner lumen of the internal carotid artery, how it is. And if we why we will do this? This is an invasive procedure. Why should we risk the patient with an invasive procedure? If we want to put a stent, if there is a need to put a stent in case of some diseases, like patient is having TIA, that is there can be temporarily ischemic attacks that the patient is having. So not to go in details right now, just understand the anatomy. So maybe patient is fainting again and again. So you cannot find anything in other investigations that are current done. But then you decide that the patient is having certain ischemic attacks. Not to go in the details of that because it is out of the uh, topic of the lecture. So once you have seen that there are ischemic attacks, so the patient has to have this carotid angiography. So what will be the, since it is an invasive procedure, so what will be the indications and contraindications? So you should be, first you should know that if the patient is allergic or not. The patient should be having no allergy to any dyes. Then the patient should have a evaluation of his cardiovascular, respiratory system, renal system, and nervous system. Yes, so then only this procedure is taken done. And the patient should have had a lot of water before the procedure is done. For the hydration should be good. Then when the dye is injected, immediately three radiographs are taken subsequently. Or nowadays even video can be recorded. How the dye is going through the uh, carotids, internal carotid artery. So then this is the carotid angiograph, and this is the AP view, and this is the lateral view. Not to go in the detail, just that you should have knowledge what this is. Now here you see the water's view. This is the one of the radiographs from our college itself, and here you see the water's view. So what is water's view? Water's view is also called as the occipitomental view. Water's view, this is very important. Even in ENT you will see this. So water's view is the occipitomental view, and the neck, as you can see, is tilted to about 45 degree. Yes, and why this is done? To see the maxillary air sinus properly. So this is the view in which the maximum you can see the maximum exposure of maxillary air sinuses, and also other air sinuses like the frontal, ethmoid, sphenoid can be seen. Sphenoid will lie just behind this, or the orbits. You can see the orbits. You can see the odontoid process of the axis. What is axis vertebra? What is the odontoid process? What is dens? Then you should know all these things. You can see the mandible. Yes, you can see upper and lower teeth. You can see the nasal septum very clearly. This one, middle nasal septum. Then these bones in the sides, cheek bones. What are they called? Zygomatic bones. You can see so many things in this. Try to answer as many facial bones as you can. They can ask you the how the orbit is made, the orbital cavity, the walls, lateral wall, medial wall, how it is made. So try to revise all your osteology before coming for exam for the radiology. So now I have shown you all the slides that are possible, and now you try to see these subsequent slides. Which view is this? This looks like the lateral view. What you can see? Skull cap. What else can you see? So revise yourself. Try to answer this. What is this? What is this? In this lateral view of the face, you see this soft tissue. Yes, gray means soft tissue. Now what is this here? This is some ornament of this lady. So first of all, while coming for x-ray, or the ornament should be removed. But this patient did not comply with the instructions. So you can see the nose pin. So ornament that they use on the nose. So nose pin you can see. Yes, so in this you can see the nasal process of the frontal bone also. This is the nasal process of the frontal bone. You can see how beautifully the soft tissue is being defined separately, and this is the bony facial skeleton. So it's a beautiful X-ray. So now, which view is this? You already know. And here also you can see the first rib also and the clavicle also. So try to answer this. This is one of the slides that we are having. Zoom it and see. This is in the college list. Now you see this is the neck. So you can see beautifully the anterior aspect of this neck in the lateral view. So here you see this bone, hyoid bone you can see. You can count the cervical vertebrae. Thank you very much.